Good evening, Berkeley, and thank you for joining me for my twice-a-week update on the City of Berkeley's response to the COVID-19 pandemic. We know that over 6 weeks ago, regional health officials, including our City of Berkeley public health officer, issued a shelter-in-place order requiring that we shelter at home and only leave in limited circumstances to conduct essential business. We know this has been difficult, not just on residents, but also on our small businesses and nonprofits. Many of our small businesses are closed and providing limited service. Our arts organizations are closed. Construction has ceased, and it has really had a significant impact on our economy. And so today I want to provide an update on several things that will really frame the issue of what's next. We know that today our City of Berkeley health officer and health officers throughout the region had announced that the shelter-in-place order that was issued in mid-March will extend to the end of May. And while I know that this is an inconvenience for many, it is essential to continue to reduce the spread of this deadly virus and to make sure that our hospitals are equipped to be able to deal with the number of cases and to also reduce the spread. So thank you for doing what you have done, which is stay at home to save lives, because it is making an impact. And just to provide some perspective, as of today, the number of confirmed cases in Berkeley are 49 cases. Of those 49 cases, 36 have recovered. We have conducted 965 COVID-19 tests of Berkeley residents to date. But compare these numbers to the numbers in the United States and also throughout the world. There are 984,000 cases of COVID-19 in the United States, and sadly 55,000 deaths. And worldwide, we're now at 3 million cases of COVID-19 and 210,000 deaths. The steps we took to issue our shelter-in-place order, which was one of the first in the country, and what we've been doing individually to stay home to save lives has helped flatten the curve. And so we must continue to stay home and also practice physical distancing to help reduce the spread and to keep our communities safe. So thank you for what you have done, and let's continue the progress that we've made. We also know that the COVID-19 pandemic has had an impact on our economy and also on local governments. And so this morning, the Berkeley City Council Budget Committee began discussions around our city budget for the next year. We are estimating a pretty significant impact on our budget, a up to 12% decrease in revenues to our general fund, which can range anywhere from $15 to $25 million reduction. And we are beginning to look at how we can balance our budget and maintain funding for public safety and essential services. So stay tuned for information about our city budget process and how you can weigh in on that. And lastly, I want to update you on our Berkeley Relief Fund. Today we announced the city is issuing $1.7 million in grants to over 300 small businesses and 47 arts organizations. The response was overwhelming. We received over 1,000 applications for our small business continuity grants. And while this represents a fraction of the need, we are continuing to raise funds to be able to support as many small businesses as we can. So please give what you can to the Berkeley Relief Fund at berkeleyrelieffund.org, berkeleyrelieffund.org. Every dollar that you give will help support our small businesses, our arts nonprofits, and residential tenants that are impacted by this crisis. And stay tuned for information on a second round of funding that we will be launching soon. And lastly, I want to invite you to join me and the city manager, D. Williams Ridley, and our City of Berkeley public health officer, Dr. Lisa Hernandez, this Saturday, May 2nd at 12 noon for another virtual town hall. Stay tuned for information on how you can submit questions and participate. And in closing, Berkeley, please continue to do what you have done, which is stay home to save lives. When you do leave the house, please practice physical distancing of at least 6 feet. Please remember to wear a face covering to reduce the spread. And please do this not only to protect yourself, but your family and your community. Please know that what you are doing is making an impact and that we will get through this. So please stay safe and look forward to seeing you on Wednesday. Thank you.